Hello, and welcome to explore the intersection of healthcare, technology, and innovation. I'm your host, Dr. Sandeep Nagre. Wearable technology, from smartwatches to fitness trackers and even advanced biometric sensors, is now more accessible than ever. But how can we use this data to improve patient outcomes? And how can it be effectively integrated into personalized health plans? Let's explore. To kick things off, let's talk about what we mean by wearable technology. You're probably familiar with popular wearable devices. These devices can monitor heart rate, sleep patterns, physical activity, and even stress levels. But newer generations of wearables are doing much more. Devices now can track glucose levels, detect arrhythmias, monitor blood pressure in real time, and analyze oxygen saturation, all while you go about your daily life. So what does this mean for personalized healthcare? How can we turn this data into actionable insights for both patients and physicians? Wearable technology has a unique advantage in that it provides continuous real-time data. Traditionally, we've relied on intermittent snapshots of a patient's health status through annual checkups, blood tests, or isolated diagnostic tests. But with wearables, we can track fluctuations in a patient's vitals on a daily basis or even minute by minute. For example, continuous glucose monitors can help diabetics manage their condition far more effectively by providing real-time blood sugar data that helps them adjust medication, diet, and activity. Similarly, tracking heart rate variability through wearables can give insights into stress levels and autonomic function, guiding interventions in mental health or cardiovascular care. The key here is integration, these streams of data as a supplement to traditional metrics, providing a fuller picture of the patient's health. The ability to monitor trends over time rather than just isolate points can lead to early detection of conditions that might have gone unnoticed. Now, let's get into the heart of the matter. How do we create personalized health plans using this data? The data from wearables is immensely valuable, but only if it's used appropriately. Physicians and healthcare providers can work with patients to integrate this data into comprehensive health strategies. For instance, if a patient's fitness tracker shows consistently low activity levels, a physician can suggest gradual increases in physical activity tailored to the patient's current health status and goals. But it goes beyond just lifestyle changes. Wearable data can inform medication adjustments, detect early warning signs of illness, or guide decisions on surgical interventions. We can adjust health plans dynamically based on real-time data trends, making them far more personalized and responsive to the patient's actual health status. Of course, this requires that both patients and healthcare providers are educated and empowered to interpret and act on the data. The responsibility isn't just on the physician. Patients also need to be engaged, understanding how their habits and behaviors reflect in the data and how they can take control of their health. As exciting as this all sounds, integrating wearable tech into personalized health plans comes with its challenges. The biggest is the sheer volume of data. Physicians already face time constraints in reviewing traditional medical records. Adding daily data from multiple wearables creates an additional layer of complexity. This is where artificial intelligence and machine learning can play a role, helping to filter, interpret, and highlight critical data points that require attention. Another concern is data privacy and security. Wearables generate sensitive health information that needs to be protected. Both healthcare providers and tech companies must ensure that data is encrypted, securely stored, and only shared with appropriate parties. Not everyone can afford wearable technology, and those with limited access to it may miss out on these personalized benefits. The healthcare system needs to find ways to make sure that advancements in wearable tech do not widen the gap in care. So, where do we go from here? What's the future of wearable tech in healthcare? Wearable technology is still evolving. We're on the cusp of seeing devices that can monitor more biomarkers with greater accuracy. Think of wearables that monitor hydration, metabolism, or hormone levels. Eventually, we'll likely see fully integrated platforms that combine wearable data with electronic health records, providing a seamless flow of information between patients and healthcare providers. As we move toward this future, healthcare providers will need to adopt new frameworks to integrate these technologies effectively. Collaboration between tech companies, physicians, and patients is critical. We need user-friendly systems that empower patients while giving physicians the tools to interpret and act on the data in ways that improve outcomes. To sum up, wearable tech is not just a trendy gadget. It's a powerful tool for transforming personalized healthcare. By integrating this technology into everyday health plans, we can deliver more timely, accurate, and personalized care that helps patients lead healthier, longer lives. Thank you for joining me today. Stay tuned for more discussions on how technology is reshaping the medical world. Until next time, take care and keep tracking those steps. Please subscribe and don't forget to share it with others who are interested in the future of healthcare.